Good afternoon. We're here on this virtual Facebook Live. I'm Michelle Young with USF Health, and we're joined by Dr. Mohanty with USF Health Cardiology. Thank you very much for joining us, Dr. Mohanty.
Thank you for having me, Michelle. It's great to be here.
Terrific. Let's get started. We're going to talk about the heart today, and I know you have some really good answers. We've got a lot of people out there concerned about their parents and about themselves that have heart issues. We're going to talk a lot about COVID-19. That's primarily what we're talking about. So one of the symptoms of COVID-19 is difficulty breathing. How can we determine or differentiate between the virus and another cardiac episode? How would someone know?
It's a great question, Michelle. It's something that we're still trying to figure out as physicians, and it's not a straightforward answer. A lot of the symptoms that you would have with COVID-19 would be very similar to a patient who's experiencing a heart failure exacerbation. And those things include shortness of breath, sometimes a cough, and of course other symptoms that often go with viral illnesses like fatigue, malaise, sometimes even gastrointestinal symptoms. A couple of the cardinal things that you might use to distinguish is firstly fever. Typically patients with heart failure don't experience fevers. It's an intrinsic issue with the heart and the circulatory system, and not an infection. Fevers are usually when our bodies are trying to fight infections. So that's an important sign, important symptom. The other is the type of cough. Typically what we're seeing with patients infected with corona, the cough is a dry, hacky, often non-productive cough. There's not much mucus. And that's because the disease, especially when it's aggressive, is affecting the lower airways. Oftentimes a heart failure cough, a patient who's experiencing an exacerbation of heart failure, their cough might have some degree of wetness to it. There might be some degree of clear to white sputum production. So those two features are important to remember. Fever and then the type of cough can help you distinguish.
It's a really good point about fever with heart issues. Good point for people to remember. If you have AFib, what do you need to know in terms of COVID-19?
So atrial fibrillation is a very common rhythm disorder, especially in folks older than 65. And we know that's the population that we're particularly concerned about because as we age, all of us, our immune systems tend to get a little weaker. And typically they serve us just fine, but when there's a new agent in the community or new virus or new bacteria that our immune systems are not familiar with or have not seen, that's the time where we have to be careful with contacts and who we're being exposed to. So atrial fibrillation is a rhythm disorder in that same population. It tends to cause similar symptoms. People will feel short of breath. They'll feel rapid heartbeats. They might experience respiratory distress and cough. But it's a very different entity. If you have any of those symptoms, of course, you should get evaluated, but they're not necessarily related. And so if there's any concern or fear as to atrial fibrillation being a reason to contract corona, that's not necessarily the case. Now, patients who are infected in the hospital, they may develop AFib as a secondary phenomenon, but as a primary connection, they're not related.
That makes sense. So let's talk a little bit about the Neuro cardiac program at USF Health. This is in cooperation with Tampa General as well. You've made some changes to be able to help a stroke patient out while the pandemic is going on. Can you talk about those changes?
Absolutely. As you know, and as our community is very well aware of, all of us are having to make changes in our lifestyle. Our day-to-day realities are very different. And one of the things we're struggling with as medical practitioners is how do we continue to care for patients who don't have corona, who have other illnesses that we normally deal with? And it's a real challenge because we want to make sure we're being safe for ourselves, for our patients, for visitors, for other healthcare workers in the hospital. We also want to make sure care is being provided for patients who have non-corona related illness. And so patients with stroke fall in that category. People are still having strokes, they're still having heart attacks, and we still want to care for them while being safe. So a couple of changes we've made within our program to help facilitate that is twofold. So a lot of stroke patients come in and have cardiac imaging performed with transesophageal echo or transthoracic echo. These are done to see if there's any cardiac component or cardiac contribution to their stroke. The challenge with these tests is, especially transesophageal echo, which is done through the esophagus, it leads to some degree of airborne material being released when the probe is inserted, and that puts our providers at risk. So what we've done is set up a consult system within our electronic order set that allows the neurologist or any operator in the hospital or any provider in the hospital to place a request that comes directly to us so that we can store these patients on a list and have them scheduled at a later date for their transesophageal echoes. And this way they'll still get their tests done, they can have whatever treatment is necessary in the hospital, and they're not lost, and that testing is not lost on them after their discharge. So that's the first strategy we've employed. The second is a lot of these stroke patients undergo rhythm monitoring. That's a small patch that's applied on the chest with a sticker to allow us to see if there's any cardiac arrhythmias, primarily atrial fibrillation, which could have contributed to their stroke. The sooner you detect these rhythms, the sooner you can treat these patients. Now, again, we're trying to keep these folks away from our clinics to prevent exposure. We're trying to get them out of the hospital. So instead of having them come in to get these patches placed on their chest for monitoring, we figured out a mechanism to have these mailed. So they're being mailed directly to the patients with instructions. Patients can put them on themselves, be monitored for whatever duration is prescribed, and then they can mail those monitors into the companies who send us back the reports. So we can still read them, we can still determine if we have to change therapy based on what we find on these rhythm monitoring strips. So a couple very clever things that I'm very proud of our program for to set up to provide care for these patients without having them be extremely delayed or completely lost to follow-up.
That's terrific. Have you also been employing telehealth with some of these things?
Absolutely. So a lot of things that we do from a preventive standpoint, patients who have stroke and heart attacks, a lot of those preventive measures we can discuss over the phone just like we are now, or over video. And you can get a lot of information just talking to a patient, being able to see them, see how they're feeling, have them describe to you what they're experiencing at home. And so, yes, as an institution, we have engaged telehealth, and it's working very well so far to keep patients engaged in their care.
That's great. Yeah, we've talked to a number of physicians that have raved about telehealth, and we've gotten some really good responses from our patients too. Well, that's really good news. So we've talked before, and we always want people to know CPR and learn CPR. We're at home now, we're sequestered. So what about people that don't know CPR but may need to use it? Is there a way that someone can learn CPR at home, watch a video, or what do you recommend so they're ready in case they need it?
It's a great question. I think what this whole episode highlights is the importance, and by episode I'm talking about the COVID-19 pandemic, the importance of all of us in the community together taking stock of our health, not as individuals, but as a community. And in the cardiology realm, understanding CPR and the use of publicly placed defibrillators is really that same theme. It's what can we do individually to help folks we might not even know. Certainly right now, we're being asked to avoid a lot of social contact. There are a lot of stay-at-home orders in most states at this point. So a lot of the classes that are done in groups are currently canceled. But there are online courses that a lot of healthcare practitioners are using as well. And these range from a variety of prices. Most of them are fairly affordable. But oftentimes they do have demonstration videos. Even if you don't go through the course, you can find demonstration videos just to get a basic sense of what CPR might look like. But I think importantly, when this is all done, it'll highlight, again, measures across the board in different health disciplines that can be engaged by the community to prevent illness down the road. So I think it's a lesson we're all learning. Stewardship of our antimicrobial practices, hand washing, the way we cough and sneeze and cover them, and then CPR, things that we can all do in preparation for things that might happen in the future.
Yeah, one of the therapists that we talked to yesterday talked about that. There will be some good things to come out of the COVID-19 pandemic because we'll learn some things for the future that will really help us. And it sounds like Absolutely. Some of that's the same. So we're all kind of been eating what we like to call in Florida our hurricane snacks. I know you're a big M&M guy. So, um, so let's talk a little bit about some healthy, affordable foods that patients can stock up on that are also heart healthy for them.
You know what's interesting, Michelle, is that the few times I've been to the grocery store recently, um, I've gone in wondering, what am I going to find? And the area that seems consistently well stocked is the fruit and vegetable area. And so there seems to be plenty of stuff there. And I think sometimes and we all do this, but I think sometimes we fool ourselves into thinking, or not fool, maybe intentionally tell ourselves, well, we're in a crisis situation, we're hoarding up at home, and we're trying to hide. Let's just let it go for a little bit, get all the chips and carby things that we can grab, and that's fine. There's some degree of there's a lot of stress actually that's out there in the community, and I think people are managing that in whatever way they see fit, cooped up at home a little bit. But I do think it's important to recognize that there are still healthy options out there. Like I said, the fruit and vegetable counters in the grocery stores seem to be well stocked. In terms of snacking, oftentimes nuts can be very healthy snacks. They're a good source of the good cholesterol, as we talk about, specifically almonds, pistachios, walnuts, less so peanuts, macadamia. But those can be gotten in a variety of flavors. They can be gotten sometimes dusted with chocolate. So it's a great option if you're just wanting to pop some in your mouth while you're sitting there watching TV. Certainly, small vegetable snacks, carrots, celeries, tomatoes, broccoli, all those things are still fairly widely available. We certainly don't want to tell you not to eat things that you enjoy, because it is that kind of a time. But there are certainly options out there that we can also incorporate. We just have to remind ourselves that just because we're indoors doesn't mean we have to completely stop with our healthy habits.
Yeah, we are going to have to put our work clothes on to go back into the office sooner or later. So,
Yes, yes, that's right.
so should heart and stroke patients continue rehabilitation during the pandemic? How important is that?
Yes, this is a great question because certainly the recovery from heart attack and stroke has a lot to do with rehabilitation. Right now, and this is widely being discussed in the news, I think it's important to recognize that there are some of these issues are indeed ethical. We want to be able to care for people. We want them to be able to care for themselves. We also want to protect each other. One of the things you can do is, if you are undergoing rehab, is to discuss with your therapist if they can provide exercise templates and worksheets and things that you can do at home. And in most instances, they can. Certainly, it may not be as rigorous, or there may not be as much time spent as you would if you were going into the office. But we know we're in a time of change and flux, and those things will come back. We'll return to those. But for the time being engaged in our health, thinking about the things we eat, engaging our therapists and our physicians to say, hey, I'm at home, I'm trying to protect myself, I'm trying to protect my family, but I'd still like to engage in activities that will continue my course and improvement. What can I do at home? And for the vast majority of cases, there are sheets and exercises that can be provided for home use.
That's terrific. That's good to hear that there are some different things that patients can be doing at home too. So our last question is also about COVID-19. We're learning so much about it as we continue to go on. If you have a heart valve problem, does this virus put you at a higher risk?
Yes, I think the first statement you made is very important, is that we're continuing every day, both as a community and as physicians and providers, to learn about this virus in a multitude of ways, both how it's behaving, whether there are multiple strains, whether some viruses cause more illness than others, what kind of treatments might be used. So there's a lot of flux and a lot of change. Patients with heart disease in general tend to be older. And I think it goes back to what we talked about earlier, that as we age, our immune systems become a little weaker and are not able to ward off things that they haven't been exposed to before. They can, for the most part, and they work very well, but they're not as adept as when patients are younger. And I think older patients tend to have a greater degree of comorbid illness, things like hypertension and diabetes, and those things then compound into cardiac illness. It's not entirely clear if having cardiac illness in and of itself predisposes to worse outcomes from COVID, but we know that there is certainly a correlation. Patients who have cardiac illness have had a high preponderance of developing it, and those same patients tend to do worse in terms of mortality afterwards. some of this data, or a lot of this early data came from China. And so obviously regions, populations, different genetic makeups are going to be expected to respond differently. And we see that around the world. There are some places where there's very few cases and other places where it's spread rapidly and causes a significant hit to the health system and economy. So in general, patients who are older, who have heart issues should certainly be more cautious. Patients with heart valve problems often will have some degree of heart failure. That is weakness in the heart muscle and its ability to squeeze. And so those patients should take particular precautions, stay indoors, washing hands, avoiding social interactions with large groups, being very cautious when they exit the home, even for things like going to the grocery or going to a pharmacy. The CDC just released some recommendations that particularly in those patients, it's advisable to be wearing masks. They don't have to be respirator N95 masks, just normal masks to at least provide some baseline degree of protection. So again, we're learning more, and we're finding out how other comorbid conditions are affecting the incidence of COVID. But until we do recognize it, we know that patients with heart issues are at least correlated to have higher risk, both of getting it and in terms of mortality if they get it. So due caution is certainly warranted in that setting.
Terrific. I think my last question would be, you've been in Tampa General, you've been a lot of different places with USF Health in the last couple of weeks. Talk about how proud you are of your profession, just the work that's being done by people knowing what they're walking into at times.
Thanks for bringing that up, Michelle. I think one of the things that gives me joy in this time is turning on the news and seeing the response, the overwhelming response that communities have had to their healthcare providers around the world. You've seen some of the things people are doing in Spain and in Italy and in India, just community demonstrations of thankfulness to healthcare workers. And it makes me feel proud of my colleagues and our compatriots in the hospital who are there recognizing there may be risk, but still wanting to help patients. And I can tell you in our meetings and our discussions, this is something that always comes up. You know, we want to protect ourselves, we want to be safe, but overwhelmingly physicians still want to be there to help patients who need it. And I think it speaks to the fact that is a lot of good, there's a lot of good intention, there's a lot of goodwill amongst us. And you see that every day in the hospital. And I think we can take that and translate that to our communities and say, hey, even if you're home, your manner of fighting this is to be home and to support the safety of those around you, support the safety particularly of our elder population, and in that way demonstrate a certain solidarity and unity in our approach as a community. So yes, I'm very proud of our nurses, our physicians, our respiratory therapists, our anesthesiologists. I think all of us want to do all we can to protect them while they're out there really risking their own safety to help these patients. And we're going to continue that fight as well. But in the meantime, I think it highlights how much good there is amongst all of us.
Thank you so much. I really appreciate your time today, and I really appreciate everything you're doing. I'm sure there's a lot of people standing behind me, 6 feet behind me, and then 6 feet, and then 6 feet. A lot of people that would say thank you very much. We appreciate it.
Wonderful. Thank you, Michelle.
Thank you.